We're the Workplace Health and Safety Association for the continuing care sector. So we cover about 850 different organizations across BC that work in either home care or long-term care. Care workers have been under an enormous amount of pressure since the beginning of the pandemic, and I think it's important for us to remember that it's been almost a year of living with COVID-19 and everything that means. So we see everything from anxiety, fatigue and burnout, but we also see the good coming out in people and some of the best that come out of people in terms of how teams are coming together to support one another, to be there for one another in what is incredibly challenging. One of the challenges that we saw come to the forefront with some of the public health orders that have been put into place, the single site staffing order, for example, has been that it's exacerbated existing staffing shortages in continuing care. So that's been challenging, and that's been an ongoing challenge throughout the pandemic. We have seen some moves by government to address that through a number of different initiatives, but it is very much a concern that's ongoing. It's hard when you work in continuing care and you're in the context of a pandemic because you live every day with not just the fear of inadvertently bringing COVID into a care home, but also too the fear of potentially getting sick yourself. And so being comfortable with the measures that have been put into place around PPE, infection prevention control, has been really important, but it also is pretty taxing to keep up with for almost a year at this point. One of the rays of sunshine that we've had in this pandemic is the vaccine. And right now what we're hearing is for people who are getting vaccinated, we're hearing things like the sense of joy and relief that it's bringing with it. And I think that's really important to remember. The vaccine isn't just about protecting people's physical safety. It's actually having a positive impact on their psychological health and safety too. One of the things we recognized really early on in the pandemic is just how important it is to have mental health supports for continuing care workers. And so that's why we partnered with Canadian Mental Health Association to do things like Care for Caregivers, to do things like Care to Speak, so that those mental health resources can go to the people in need and hopefully give them the support they need when they need it, so that nobody has to suffer alone or suffer in silence.